Welcome to episode 13, what every ostomy patient should know before leaving the hospital. Hi friends, and welcome back to Ostomy Care with Angelfaceamy. I'm Amy, a wound and ostomy certified nurse, and I'm here to help you feel informed, empowered, and confident in your ostomy journey. So if you or a loved one just had ostomy surgery or you're preparing for one, this video is for you. Today we're talking about what every ostomy patient should know before leaving the hospital. So this is key to make sure you get the right information and the right supplies before you leave the hospital. Because when you're recovering from surgery, it's easy to feel overwhelmed. But before you head home, you're going to want to make sure you ask these key questions. The first one is, who should I call if I have an issue with my ostomy at home? So this is important because you want to make sure you have the phone number and the name of a person that you can call if you have an issue. You need to know what is an emergency and what is just something that you're going to want to call a wound or ostomy nurse, and then what is something you should notify the surgeon for. The next question that you're going to want to make sure you know the answer is will you have a follow-up appointment with the surgeon and or an ostomy nurse? And then how do you get or order your supplies? And how long will these supplies last? So a lot of times I send my patients home with a small bunch of supplies so that they have everything they need for the first few days. But then the home health nurse usually orders more supplies. But I always enroll my patients in a secure start program. So they always get the phone number and the information and a sample box sent to them so that they can get future supplies and they can work with their insurance to get their month supplies mailed to them. Then the next question is, can you show me how to empty, change, and care for my pouch again before I go? So a lot of times I and ostomy nurses or regular nurses are going to show you how to empty your pouch, but it's okay to ask for a second or third review because this is a big life change and repetition helps. So you might need to do this all of a sudden on your own at home, and having been shown how to do this is really important. A lot of times I show my patients and we talk about it, and then I give them a step-by-step guide that I send home with them, and then I try to go back a third time and have the patient help me change their whole entire pouch system. So that way they've actually done it in case something happens urgently before their home health nurse even comes after they're discharged. It just makes everybody feel a lot more confident if you've done this once with help nearby. That way you can do it on your own if you needed to when you got home. Okay, now we're going to move on to supplies. You should go home with or have a starter kit at least mailed to you. And in this starter kit, there's going to be extra samples of pouching systems. So there's going to be skin barrier rings or paste, skin protectant. Sometimes there's stoma powder. And then you're going to want to make sure you have a measuring guide and a pair of curved scissors. And then also an instruction sheet, like I was talking about, a step-by-step guide with pictures is really helpful in case you need to do this on your own. And then emergency contact information, who you call if you have a problem. It's a bonus if they give you a mirror, but if they don't, just grab one from home. A small hand mirror helps you see under your belly and makes pouching way easier. So what you're to do if your bag leaks on day 2 at home. Let's be real. Things don't always go perfectly, especially in the first week. And that's why it's so important to learn what you can before you're discharged from the hospital, even if they order a home health nurse. So what if your bag leaks on day 2 at home before the nurse comes? First, don't panic. It's frustrating, but you're not failing. This is why it was so important to be shown how to deal with this when you were in the hospital. The more you do these things, the easier it will get. So first, you'll just want to clean up whatever the leak, the spill. You want to clean up your skin with some warm water. You want to use your mirror to get a good view of the bag and the whole system. You want to check, did the bag get over full? Is the bottom closed all the way, or is it just leaking out the bottom? If it's a 2-piece appliance, is it connected properly? Or did it become unattached to each other? If you can't fix it and the seal is compromised, you're going to have to try a new pouch. So you're going to go through all the steps that they showed you when you were in the hospital, and you're going to take off the old one and you're going to apply a new one. But if you're still struggling and you can't get a good seal and it continues to leak, you're going to want to call your home health nurse or your ostomy nurse. If you weren't assigned an ostomy nurse, you can call your surgeon's office. You should not be navigating this alone. There should be access to an ostomy nurse who specializes in this somewhere. So here's a few tips that I have to make things easier. As a wound and ostomy nurse, I tell all my patients to keep a mini ostomy kit in every bathroom that you regularly use, and then have it ready to go to take with you when you leave home. This kit should include a small mirror, scissors, an extra pouch and wafer, which is already cut and ready to go, paper towels, gauze, or some kind of soft cloth, and a disposable bag. Because when things go wrong, you don't want to be running around the house trying to find supplies. It makes it so much easier if you have what you need. So going home with an ostomy is a huge transition, but you don't have to figure it all out overnight, and you don't have to do it alone. If this video helped you, please like and subscribe. I post new videos every week right here on Ostomy Care with Angelfaceamy, with expert tips from a nurse who truly cares. And I would love to hear from you. If you have a question, drop it in the comments. I'd love to answer it or make a video just for you. Until next time, take care of your skin, your stoma, and yourself. You've got this.